We have statistics and articles that we're looking at that are actually showing us that we can measure the metrics and see how burnout or how not professionally satisfied our folks are in the fields of not just internal medicine, but all fields across the board in the world of medicine, and finding that we actually can say how burnout they are, not only just at different institutions, but amongst their peer groups or their genders, and get some real statistics that then we can start to correlate with things that are happening across different organizations. So looking at ways that we can help our profession actually be sustainable, because we're finding that with the statistics that we're seeing, it may not be that we've got a real sustainable situation going on. We have statistics that show us that not only do we have things like people retiring early, people leaving their practice, people producing less, people actually trying to get out of patient work, which is the last thing that you would ever expect any of our physicians to say is, I need to try to find something that I can do that gets me out of seeing patients so much. So there's something really wrong with that. But now we're correlating it with the organizations that are having patient safety errors that are increasing. We're finding that we've got it correlated with quality of work that's being done, how productive people can be, the patient satisfaction scores, the team engagements. But the worst thing is that we're actually really correlating it with suicides. And especially with female providers, we have statistics that show us that our female physicians are 2 to 3 times more likely to commit suicide than the general population, and that's a pretty serious statistic. We know that physicians, if they're going to commit suicide, they're usually pretty successful because they've got the tools to be able to do that, and they don't ask for help very often. And so this is something that is above and beyond what we've ever seen before. So if one provider that had maybe 2,000 people in their panel of patients that they saw, for 400 physicians that commit suicide in a year, that means that there's 1 million patients in the United States that lose their doctor to suicide in a year. If we had an emerging infectious disease thing like Zika or Ebola that was killing 1 million patients, 1 million different people in the country in a year, we would be looking at that so quick. It would be on every news show. It would be on every front page of every article that you could find. And this is serious. We're finding it in newspapers. We're finding it in articles. We're finding it in our throwaway journals. But now there's been this huge evolution of actual peer-reviewed journal articles in New England Journal of Medicine, JAMA, Annals, all talking about the correlations and the things that are really serious that are going on with physician burnout.